Hello all, this is Dr. Nandan. In this video, we are going to learn how to remember this Benralizumab with respect to NEET PG question. Okay, so here the question is as follows as per NEET PG previous year questions. A 36-year-old female with severe eosinophilic asthma continues to have frequent exacerbations despite treatment with high-dose inhaled corticosteroids and long-acting beta-2 agonists. Her blood tests reveal marked eosinophilia. The pulmonologist initiates benralizumab as an add-on therapy. So what is the mechanism of action of benralizumab with respect to the target? Here in this question they are asking you the target of benralizumab. So what is the mechanism of action of benralizumab? As we know, benralizumab is a monoclonal antibody. Okay, MAB, monoclonal antibody. So this blue one is the benralizumab drug. This is a genetically engineered monoclonal antibody. Okay, so it is binding with the eosinophils here. Okay, it is parallelly binding with the natural killer cells also. How this happens? First, this benralizumab with this portion, okay, it is binding to the alpha subunit of the receptor present on the eosinophil. What is this receptor? This receptor is meant for actually IL-5, interleukin 5. Okay, so this is the actual original site of binding with the interleukin 5. Okay, this alpha portion of alpha subunit of this receptor on the eosinophil, it is to be bind with an interleukin 5 naturally. Okay, during this disease exacerbation. So we want to prevent the disease exacerbation. So we want to prevent IL-5 binding to the receptor. So who is the more competitor? This is the monoclonal antibody benralizumab. It is binding to the receptor, interleukin 5 receptor with alpha subunit. At the same time, the tail portion of this monoclonal antibody is binding to natural killer cell, okay, with the receptor Fc gamma R third A. Okay, this receptor is present on natural killer cell. So this monoclonal antibody is bringing two things, eosinophils and natural killer cells together. So as this natural killer cell will kill the eosinophil through apoptosis. We call this as antibody dependent cell mediated cytotoxicity. So here the original so here the main challenge comes. How to remember this benralizumab? Okay, benralizumab, if we see eosinophils, this eosinophil we can see here, right? Eosinophil, ESINO. Okay, as per US pronunciation, eosinophil, it has 5 alphabets. Okay, and benralizumab, here we can see IL, interleukin in reverse. Okay, I, interleukin in reverse direction. IL, interleukin 1, 2, 3, 4, 5. 5. Here we can see 5. Here also we can see 5. That is, benralizumab is a 5-letter word. Okay, 5-letter phrase, 5-letter thing with interleukin 5. Okay, and eosinophil, 5-letter word. Okay, eosinophil is having a natural propensity of binding with interleukin 5. Benralizumab also binds with the receptor meant for interleukin 5 on the eosinophil. Okay, and what are the original indications of benralizumab? Here we can see benralizumab is used for add-on therapy, that is a maintenance therapy for severe asthma with eosinophilic phenotype, just that we have seen in this case. And another disease is EGPA, that is eosinophilic granulomatosis with polyangiitis. It is also used. And HES, hypereosinophilic syndrome. These three are the indications for benralizumab, but the limitation for use is this is not at all used for relief of acute bronchospasm or acute this status asthmaticus, which we see in casualties. Okay, and this is a short version of the benralizumab you can see here. Okay, so as to memorize everything. So the final answer will be interleukin 5. Option B is the final answer. Thank you for watching.